everyone, and thank you so much for taking time out of your day to join us for today's Needy Meds special topic webinar, Ways to Minimize the Financial Impact of Cancer, presented by our friends at Triage Cancer. My name's Carla. I'm the Director of Education Initiatives here at Needy Meds, and before we get started, I'm going to offer a few tips so you can make the most out of today's presentation. First of all, we do encourage you, of course, to ask questions, and you can do so by typing them into the questions section. For some of you, it may be the chat section of that GoToWebinar control panel. Just know we will reserve answering questions until the end. If we don't have the time to answer your specific question, and we may not because we do keep the question segment relatively brief, please know we will follow up with you by email as soon as we can. However, following the webinar, if you do need a response immediately, you can reach out to Triage Cancer. We will provide their contact information and, of course, the contact information for Needy Meds as well. Happy to let you know that today's presentation is being recorded and will be available on the Needy Meds YouTube channel. One thing I do want to stress about that, we're happy to continue to share uploaded webinars on that channel, but a lot of time, and this will be true of today's special topic webinar, the information we're sharing in the webinar is timely. So it may not be true a year from now. Just keep that disclaimer in mind as you check out this webinar once it's uploaded, as well as other Needy Meds webinars uploaded. Also, as you saw my first slide, we did upload some materials we thought you'd be interested in into that handout section of your GoToWebinar control panel. I also mentioned if that control panel is smack dab in the middle of your screen and obstructing your view, you can simply drag it to the corner or to the side. Just remember not to X out of it because unfortunately it'll drop you out of the presentation. Okay, so let's move on and really quickly just start with what is Needy Meds. For those of you that have joined us, you're not yet familiar with who we are, and we do hope moving forward you stay in touch. But simply put, Needy Meds is a national nonprofit co-founded just over 2 decades ago. I think we're about at 25 years ago by a retired family physician, Dr. Rich Sagal, and his friend Libby Overly, who is actually a medical social worker. What you're looking at is our mission statement, but simply put, Needy Meds connects people to healthcare savings and education programs. And we do that free and anonymously through our website, needymeds.org, and our toll-free helpline, 1-800-503-6897. And as I said, I will have that contact information available again at the end of the presentation. I'll take just a quick moment to remind everybody or let you know if you're not yet familiar with this. If you go to needymeds.org to find those healthcare savings resources, you would check out the aptly named Healthcare Savings tab, as indicated in that screenshot of our homepage you're looking at right now. Under that Healthcare Savings tab, you'll find a whole bunch of ways to save on your healthcare expenses, including ways to save on medications, but not limited to only ways to save on medications. So when time allows, check out that Healthcare Savings tab and don't hesitate to reach out to our expert counselors at that toll-free helpline number, which you can find in the top right of our website. I'm letting my mouse bounce around over there. A couple of other things I'll point out right next to that Healthcare Savings tab is the Education tab. And again, when time allows, check it out. That's where you can stay up to date with what's going on with Needy Meds by signing up for upcoming webinars, enrolling in our recipient list to receive our monthly e-newsletters, and even learn about ways to participate as a volunteer ambassador. I mentioned that today's webinar is being recorded and will be uploaded onto our YouTube channel. You can see I just popped up a red box around our YouTube icon, which is on the top right of needymeds.org with the rest of those social media icons. Of course, we encourage you to check out and follow us on social as well. So let's transition to talking about why everybody's here, which is Triage Cancer and what we're going to focus on in today's presentation. So as I said in the beginning, and you may have saw on my screen, a big part of our mission is education. And of course, we fulfill that part of our mission by educating people about needy meds and the resources we have to offer. But we also fulfill that piece of our mission by educating our users about other resources available for them, their families, their loved ones, or their patients and clients on their healthcare journey. We are so proud to have a partnership with Triage Cancer and so pleased that my friend and colleague Amanda took time out of her day to share her expertise about Triage Cancer and how they can help you. So first of all, those of you not familiar with Triage Cancer, obviously Amanda will talk to you quite a bit more about what that is, but I just wanted to let you know that they are also a national nonprofit. They provide education on the practical and legal issues that may impact individuals diagnosed with cancer and their caregivers. Super important. And as you can see from this screenshot of their website, it is a very well thought out website. It's easy to negotiate and it's intuitive to find what you need. So again, I recommend taking time out of your day to peruse Triage Cancer because like me, you're going to be blown away by the resources that they offer. So let's talk about Amanda just for a moment because she is taking time, as I said, to share her expertise about ways to minimize the financial impact of cancer with our attendees today. Amanda Goodstadt is a staff attorney with Triage Cancer, where she works on their legal and financial navigation program. She creates resources and, as evidenced by today, presents educational materials about issues that impact the cancer community. So prior to joining Triage Cancer, Amanda spent more than a decade counseling seniors and caregivers about Medicare and related benefits. So as you can see with that introduction, that's why we are so thrilled that she was willing to come here and do this presentation for the Needy Meds family. So without further ado, and I always say this hopefully seamlessly, I'm going to go ahead and pass the mic and the screen to Amanda. And as she grabs that, I will remind everybody that, again, if you do have questions, we encourage you to submit those. And you can do that by simply typing them in to the questions section or for some of you, it may be the chat section of your GoToWebinar control panel, and we'll do our best to get it to as many of them as we can. So with that, Amanda, I can see your screen perfectly clearly in slideshow mode. I'll go ahead and pass the mic to you. Thanks, everybody, for being here and enjoy the presentation.
Thank you so much, Carla, for that lovely introduction, and thank you for inviting Triage Cancer to present today's webinar about considerations for managing the financial impact of cancer. As Carla mentioned, for those of you not familiar with us, Triage Cancer is a national nonprofit that provides free education on legal and practical issues that may impact people diagnosed with cancer and their caregivers. And we provide that education in a number of different ways, including through events like the one you're here for today, as well as through developing and sharing resources. You can find details about all the different things that we do on our website, triagecancer.org. I want to highlight our free one-day conference. We are having 2 conferences this year. They'll both be virtual, one on May 20th, one on October 14th. We also have a monthly webinar series. All our events are free. They're open to anyone with an interest, and you can see details and registration information on our website. That's also where you can find links to our numerous written materials and other resources. We have a lot going on, from quick guides, which are fact sheets that cover a variety of topics, to our comprehensive practical guides, to our animated videos, a podcast, and a lot more. We have a lot of state-specific legal information, as well as contact information for state offices that you may find helpful. I mentioned a whole bunch of our resources on today's slides. Anything that I talk about or that you see on a slide, all of those links are collected together and they are in a resource document that Carla shared in, I guess, the handouts section of the webinar platform. So people are pretty accustomed at this point to hearing about the physical toxicity that can be associated with a cancer diagnosis, whether that is toxins that might be linked to causing cancer, or treatments that are effective in fighting cancer but have a toxic impact on the body. Just as there is physical toxicity, there is also financial toxicity, negative financial side effects that are caused or exacerbated by a diagnosis. And unfortunately, financial toxicity can be every bit as significant as physical toxicity. And in fact, it impacts not just the person who's been diagnosed, but their entire family. There are a number of factors that impact someone's overall financial health. And of course, each person's financial situation is different. However, one factor that stands out as common to everyone with a diagnosis is health insurance status, whether someone has coverage, whether their coverage is adequate, and whether they know how to use that coverage effectively to try and minimize expenses. And of course, that includes managing medical bills. But health insurance status isn't the only contributor to financial toxicity. Other factors that can have a significant impact on someone's financial health include employment, whether or not someone is working, and if someone isn't working, whether they can access disability insurance, as well as other life or family changes, moving, or changes to someone's household. Today, I'm going to talk a bit about managing medical bills, and then I'm going to share some basics about employment and disability insurance. So as a reminder, before you even get to the point of managing medical bills, one way to reduce the number of bills you receive in the first place is to try and select the best health insurance plan for your circumstances. Make sure you understand the terms of your plan, use in-network providers if at all possible, and keep track of where you are with respect to your out-of-pocket maximum so you can use it to your benefit. I'm actually going to be presenting another Needy Meds webinar on April 11th that focuses specifically on understanding health insurance and how to select a plan, and that's where I'll be covering this information in detail. The reality, though, is that even if you have adequate health insurance, and even if you use it as effectively as you can, it likely isn't going to completely eliminate having medical bills. And often people are left feeling like the guy in this cartoon. I can't endorse his coping strategy, but I can make some suggestions about things that might reduce his anxiety around his medical bills. And these suggestions aren't just for bills that someone gets during their initial active treatment. You can continue to use these strategies during any surveillance or follow-up care. These tips are even ones that all of us as consumers can consider as we get any kind of health care. Once you have received care, you are probably going to get a lot of correspondence. And the first place you're going to get that correspondence from is your insurance company. From the insurance company alone, you might get multiple pieces of mail or multiple emails about the same service. You might get a communication that the company received a claim, and then another communication that they're processing the claim. The communication that I want to focus on is the final communication typically, and that is an explanation of benefits, or EOB. You can usually tell something is the EOB because somewhere in big letters it will say this is not a bill, and it isn't. Instead, it's a statement that's going to give you an idea of how much money you are going to have to pay out of pocket. EOBs can sometimes be challenging to decipher. So every insurance company is going to present their EOB information in a slightly different way, but this slide is an illustration of how it might look and the types of information that you are generally going to find. So first, you have that telltale sign, this is not a bill. You're also going to be able to see information somewhere on the form about who the policyholder is and who the claim is for, as well as a summary of the claim. Then you're probably going to get additional detail, like in this chart, where you're going to see a date of service, a description of the service, maybe a CPT code, the amount that's billed, the amount that isn't covered. Sometimes the amount not being covered has to do with the difference between what a provider bills and what the insurance company has contracted with them to pay for certain services. Finally, the EOB is going to show what they believe that you owe, as well as where you are with respect to any deductibles and out-of-pocket maximums. And as I talked about before, keeping an eye on the out-of-pocket maximum can be really helpful. The other party that's going to send you mail after you receive a service is your provider, the doctor, the hospital, the lab. What they're going to send is a bill. In my experience, providers are a lot faster at sending out bills than insurance companies are at sending out EOBs, which is why it is critical to keep track of your paperwork. If someone pays a bill before they look at the corresponding EOB, they may end up paying more to the provider than they actually owe. And then they end up in a situation where they have to ask for money back from the provider, which can be a headache all its own. So if possible, wait until you get an EOB before you pay a bill, but communicate with your provider to let them know that that's what's happening. So don't wait, have a due date come and go and never say anything, because then the provider thinks you're just not going to pay. Typically, what I will do in this situation, or suggest someone else do, is call up, say, listen, I haven't gotten my EOB yet. Can you please push back the due date on this bill or make a note in my file? Then once you have the bill and the EOB, you check them for accuracy. Medical billing is a human process and people make mistakes. So it's important to make sure that you are being billed for the services that you actually received. Medical bills can keep arriving long after someone's treatment is over. If you have extensive bills and you don't feel like you can handle them, and you don't have a friend or a family member who can help, you can consider speaking with a professional bill reviewer or a medical claims organization. Each of these companies is different in terms, or can be different in terms of how they charge for their services. Sometimes a company will charge an initial fee. Sometimes they won't do that. They'll just charge a percentage of whatever they're able to recover for you. I'm not endorsing using any of these services in particular, but I do want to make you aware that they're out there if you might need them. It is critical to dispute bills if there are problems. And if you think a procedure or a treatment should have been covered and it wasn't, know that you have the right to appeal that decision. Health insurance companies deny claims a lot. And what's incredible is people overwhelmingly accept those denials without asking any questions or arguing. So we like to encourage people not to take no for an answer. Appeals is a big subject that could be a webinar all on its own, but I want to just offer some basic tips. The first is you have to know what type of plan you have. Appeals processes vary not just depending upon which insurance company you're working with, but they also vary depending on how someone gets their insurance. So there is a different process for individual health plans, like marketplace plans, than there may be for different types of employer-sponsored plans. And then there's a different process for Medicare, Medicare Advantage, Medicaid, other types of insurance. So it's critical to know what you have. It's also critical to find out the reason for a denial. Sometimes claims are denied for something relatively simple, like a coding error or something else administrative. However, other times the denial is more complicated and an insurer is questioning whether something is medically necessary. If something is denied for medical reasons, it's critical to get your healthcare provider involved with your appeal. You're going to need your healthcare provider to explain why a service is in fact medically necessary, and hopefully to help support that with peer-reviewed studies or other supportive information. It's important to make sure you have a copy of your insurance plan, as well as copies of all relevant medical records, and it's really, really important to stay organized. Triage Cancer has considerable resources available to try and help you understand the appeals process and to get organized, including a recorded webinar on this topic, as well as a health insurance appeals tracking form so that you can easily remember deadlines and have one place where you are recording all of the different interactions you've had with your insurance company. There are reasons other than the appeals process to keep records and to stay organized. One of which is tax season. So tax season's approaching, and it's a good time to point out that if you have unreimbursed medical expenses, they may be tax deductible, and you're going to want records for when you prepare your tax returns or you have someone assist you in preparation of the tax returns. To help people stay organized, we have a relatively new resource, which is our medical bills tracker. This is great for situations where your EOBs may not clearly track where you are in terms of meeting your deductible and out-of-pocket maximum. You can download this resource from our website. It will open as a Google Sheet. At the top, you fill in your deductible and your out-of-pocket maximum. And then at the bottom, there's space for you to log each of your medical bills. And when you do that, the worksheet will automatically track where you are in terms of meeting your deductible and your out-of-pocket maximum. Last year, the three major credit reporting agencies made some changes that I wanted to make sure everyone is aware of. As of last summer, paid medical collection debt will no longer be included on credit reports, and the time period before unpaid medical collection debt appears on those reports was increased. This year, medical collection debt under $500 is no longer going to go on credit reports at all. These changes are said to be removing nearly 70% of medical debt from credit reports. So this is great news for consumers. And finally, I want to end the portion of this webinar concerning medical bills by reminding you that if you are in a situation where you owe money to your healthcare provider, try talking with them and try negotiating. We suggest doing this before they turn over unpaid bills to collections agencies to try and help protect your credit rating. If you can't make a payment, ask for more time. See if the provider would be willing to negotiate a payment plan or accept a lower lump sum payment. These suggestions can also apply to other creditors like landlords, student loan companies, credit card companies. Sometimes creditors are flexible, especially if they know you are facing a significant hardship. The motto we like to go by is, it can't hurt to try. So I want to switch gears now and move to another topic that impacts finances, and that is someone's employment status. I'm going to start by recognizing that each person's position within the spectrum of employment is going to be different. You may be someone who's working through treatment. You may be someone who's taking time off. Maybe your goal is to return to work full-time as soon as possible. Maybe your goal is to maximize any paid time off you have and then retire. Situations are going to differ, and so some of the things I'm going to talk about may feel more or less relevant for your situation. One of the challenges for folks who've been diagnosed with cancer and their caregivers when they're trying to balance a diagnosis with employment is battling assumptions around what someone can or cannot do. Sometimes the assumptions are your own. You're an employee, you are struggling with continuing to do your job in the same way that you always have, and there don't seem to be readily available resources to show you alternatives. Sometimes the assumptions are coming from the employer or from colleagues who make assumptions about the employee's ability to continue working through treatment and whether they can keep doing their job in the way they always have. It's worth noting that those assumptions aren't necessarily made with bad intentions. It could be an employer thinking, I'm really fond of this person. They're a great employee. They're going through such a tough time. If that were me, I would definitely not be able to work. Finally, healthcare professionals make some assumptions. Physicians may tell their patients, just take time off work, just go out on disability. That's not available to everyone. Not everyone can afford to take time off work, and some people don't want to take time off from work. They really like their job, or they really like the distraction that their job presents at this time, or maybe being at work really allows their support system to be in full force because they are close with their colleagues. So there are a lot of reasons why someone may want to continue to work during treatment. We are not advocating one thing or another. We just want people to know what all of their options are so they can choose the option that is best for themselves. When we talk about employment rights, there are a lot of places to go and see what rights we have. First, there are laws that we call fair employment laws that protect people against discrimination in the workplace based on their medical condition and give them access to something called reasonable accommodations. And I'm going to talk about that at greater length in a moment. Fair employment laws exist at the federal level, meaning they're the law in all 50 states, but they also exist at the state and sometimes even local levels. The major federal fair employment law that I'm going to talk about today is the Americans with Disabilities Act, or ADA. Now, in addition to fair employment laws, there are also leave laws that allow someone to take time off work and provide some job protection and sometimes even some health insurance protection. Those laws also exist at both the federal level and the state and perhaps local level. The major federal leave law that I'm going to talk about today is the Family and Medical Leave Act, or FMLA. Now, in addition to all these laws, we sometimes forget that some of us work under the terms of an employment contract. You might have an individual contract, which has information that is specifically about you and your benefits. But also, if you are a union member, then your union's collective bargaining agreement is your employment contract. And that may provide additional information about whether or not certain benefits apply to you. Before we start getting into some of the legal protections that are available, it's important to remember that laws just provide the bare minimum of the benefits that employers must provide to their employees. There are plenty of employers that provide options and benefits that are much better than the bare minimum required by the law. So you have to look at your employer's policies to see what options you may have, in addition to looking at laws. Your employer's policies might be in an employee manual. There might be another type of policies and procedures document at your workplace. You might have an employee portal that you can access online. If you don't have any of these things, then talking with your human resources representative is a good idea. And if your company is smaller and maybe doesn't have its own HR department, you can try starting with whoever at your job handles employee benefits or payroll. Policies can include a lot of different things. So for starters, they can include employee benefits that are provided by your employer. That could cover insurance, so your health insurance, dental, vision, disability insurance, maybe even life insurance. You also may have other benefits like access to paid sick time, paid vacation time, or just general paid time off. Some companies have pools of donated hours so that an employee who isn't using all of their paid time off can donate unused hours to a colleague who needs more time. Benefits could also include the opportunity for flex time, for job sharing, telecommuting, access to employee assistance programs. In addition to all of these benefits, another important thing to look for in your employee manual is whether your employer has a process to ask for a medical leave and or a process to request a reasonable accommodation. Not all employers have these processes, but if your employer does, it's very important to follow them. Since I'm limited in my time to speak today, I'm just going to focus on the two major federal employment laws that I mentioned earlier, the first of which is the ADA. So the Americans with Disabilities Act covers discrimination in a number of different contexts, but Title I of the ADA is the section that focuses on employment, and it is enforced by the Federal Equal Employment Opportunity Commission. Not everyone is eligible for protection under the ADA. As with most laws, there are certain requirements that need to be met in order to use the protections included in this law. First, an employee has to work for a private employer with at least 15 employees or for a state or local government. If you are a federal employee, you're not covered under the ADA, but you're likely to be covered under a different federal law called the Rehabilitation Act of 1973 that is very similar. In addition to working for a covered employer, you also have to be a qualified individual. Legally, that means an individual who can perform the essential functions of the job with or without a reasonable accommodation. Practically, what that means is you're qualified for the job and you can perform its key responsibilities. But you can get help to do that through an accommodation, which I'm going to come back to in a moment. The final requirement is you have to have a disability within the ADA's definition of that word. Every law that uses the term disability likely has a different definition of what that word means, so you have to understand here what it means for the ADA. It's worth noting that a lot of times someone with a cancer diagnosis might not think of themselves as someone with a disability. I am all for describing your circumstances in a way that feels right to you, but for legal purposes, try not to get caught up in labels because you don't want to miss out on protections that would apply to you. Under the ADA, disability is a physical or mental impairment that substantially limits one or more major life activities. So let's break that down. First, you have to have a physical or mental impairment. Second, it has to limit a major life activity. And third, that limitation has to be substantial. It can't be minor. It can't be something that only happens once in a while. What's a major life activity? Pretty much anything the average person in the general population can do with little or no difficulty. So things like breathing, sleeping, walking, talking, eating, concentrating, even the operation of your major bodily functions. You could have one physical condition that impacts one major life function, or you could have multiple conditions that impact multiple major life functions. And when we're talking about cancer, sometimes it's not the diagnosis itself that creates a disability, but the side effects from treatment that someone's experiencing, like nausea or lymphedema or fatigue or anxiety. It could be just one of those side effects is substantial, or it could be that it's a combination of those things that creates the presence of a disability under the ADA. When we look to see if someone has a disability, we do that on a case-by-case basis, meaning we look specifically at the individual and how their medical condition is affecting them. We don't just classify anybody with cancer as being disabled under the ADA. Once you've shown you're a qualified individual and that you have a disability, there are 4 ways someone can access the ADA's protections. You might be someone who currently has a disability. For example, you are in treatment, having chemo, constantly physically sick. You might have a history of a disability. You're a cancer survivor who's out of treatment. You don't have current limitations on your ability to work, but maybe your potential employer doesn't want to hire you because they're afraid you'll get sick again. You could be regarded as having a disability. This isn't so much about you, but about your employer's perception of you. Your employer regards you as being disabled and treats you differently because of that belief. So, for example, you lost hair following chemo. You're otherwise ready to work, but your employer assumes that you're still sick because of your physical condition. So even though you might not be substantially limited in any way, that's enough for protection under the ADA. And finally, the 4th way you can be protected is based on an association with a person with a disability. And that's where caregivers might be able to be protected from discrimination under the ADA. The ADA applies to all phases of the employment process, which means it doesn't just provide protection when you're an employee, it also provides protection when you're a job applicant. Before you even get the job, you are entitled to protection. What does the ADA actually do for you? In all 4 of these circumstances, it protects you against discrimination in the workplace. But if you currently have a disability or you have a history of having a disability, in addition to being protected from discrimination, you may also be entitled to reasonable accommodations. Legally, a reasonable accommodation is any change in the work environment or in the way things are customarily done that enables an individual with a disability to enjoy equal employment opportunities. I find that one of the best ways to talk about reasonable accommodations is to use examples, because practically speaking, a reasonable accommodation can pretty much be anything, so long as it's both reasonable and effective. So I'm going to divide my examples into 3 main categories. The first is about adjustments to physical workspace. This could include things like moving someone's office or getting special equipment or furniture. Maybe there's an employee who could use a closer parking spot because they have a lot of fatigue. Maybe the employee needs workspace that's located closer to a restroom or on a different floor where there is a restroom because they need to make frequent trips to the bathroom. This could mean telecommuting, which could mean working from home, which obviously many of us have become accustomed to, but it could also mean working from a different location, like an infusion suite, or maybe a satellite office that's closer either to someone's home or to where they get their treatment. This could be important for a number of reasons, one of which might be commute, but also it could be important in terms of the number of people in an office, exposure to germs, whether there's an opportunity to have your own office with a closed door versus being in an office space where you're sharing with others. The second major category for accommodations has to do with making changes to someone's schedule. So there are different ways to adjust schedules. It might be about adjusting hours or changing a shift. Maybe someone is nauseous in the mornings but able to work in the afternoons. Or maybe someone is fine most of the day up until mid-afternoon, but at that point becomes so fatigued that they need to stop working. Someone could need a flexible schedule or additional breaks. A reasonable accommodation might even be about taking an extended leave of absence. Then the final category that I use is really the catch-all for the other types of accommodations. So these range, right? Maybe this is about using technology. Someone is dealing with neuropathy in their hands and their job involves a lot of typing. Perhaps there is some speak-to-type software that can be helpful for them. Maybe the accommodation is about changing a workplace policy. So perhaps someone works in an environment with a strict dress code and they are experiencing a lot of temperature sensitivity and would like an accommodation to be able to wear a coat or a hat at work because of that temperature sensitivity. An accommodation could be about shifting responsibilities. So perhaps there's a school teacher who, in addition to their classroom obligations, has recess duty or needs to help at the drop-off line in the mornings. Maybe that teacher is experiencing fatigue when they're on their feet, so that it would help them for the drop-off line or the recess duty to be shifted to someone else, and during that time, the teacher can just rest. Finally, an accommodation can even be about changing jobs entirely within an employer. This is thought of as the accommodation of last resort because it only works if there's a vacant position that's available. Employers aren't required to create a whole new job for someone, but if there is a vacant position the employee is eligible for, it could be about shifting to a new job. Sometimes we speak with someone who says their employer has been really helpful and really supportive, and they just hate to ask for one more thing. The reality is that employers are required to provide eligible employees with reasonable accommodations unless they can show that doing so would be an undue hardship or a direct threat, both of which are pretty high bars for an employer to meet. That being said, an accommodation does have to be both reasonable and effective, and whether it is will be specific to someone's job, to their employer, and their needs. What's reasonable and effective for one employee may not be reasonable and effective for another. So for example, if you work for a transportation company, someone in an administrative role might be able to telecommute and do their job, but someone who's driving a bus probably can't. An accommodation has to make sense based on your specific job responsibilities. As we saw earlier, caregivers are not entitled to reasonable accommodations under the law, but this could fall into a category of it can't hurt to ask, because we do know that employers want to keep valued employees. So nothing stops a caregiver from making a request and seeing if an employer is amenable. Employees should ask for an accommodation as soon as they realize they need one, because if the employee doesn't ask and whatever they're coping with starts to impact their job performance, the employer can end up making decisions like a demotion, for example, based on job performance. In terms of how someone asks, an employee doesn't have to specifically say, the words ADA or reasonable accommodation in order for an employer to be obligated to provide one. But the employee does have to provide enough information for their employer to understand that what they're asking for is an accommodation and not just a favor. I want to mention one very valuable resource called the Job Accommodation Network, or JAN. JAN is a program funded by the United States Department of Labor. Their mission is to help both employers and employees navigate reasonable accommodations. They have an excellent blog, and they have a searchable online database where you can put in information about what you do and what side effects you're experiencing. And the database will give you information about accommodations other people have received in similar situations. When you're asking for an accommodation, recall that I had suggested looking and seeing in your whether your employee manual says your employer has laid out a specific process for doing that. If they have, you should follow that process. If they don't have a specific process, you can ask whoever at work you are most comfortable going to. So maybe that's your supervisor, maybe that's someone in HR. You have to take into consideration your workplace and your workplace's culture. If your supervisor is your biggest advocate, maybe you want to go to them first. If you're concerned about how your supervisor might respond, perhaps it's better to start with HR. Also know that you're not limited to asking for only one accommodation to solve every issue you may have. You can request as many accommodations as you think you'll need, and as your needs change over time, so can the accommodations that are being provided. So the second federal law that I want to talk about today is the Family and Medical Leave Act. And this is for employees who need to take time off work due to their own serious medical condition or to care for certain family members with a serious medical condition. The FMLA is enforced by the U.S. Department of Labor's Wage and Hour Division. Note that if you're a caregiver, you can only take FMLA leave to care for a parent, a spouse, or a child with a serious health condition. It's a pretty narrow definition of family members. No grandparents, no siblings, no aunts or uncles. There have been some efforts made to expand access to the FMLA in Congress, but nothing has been successful to date. Be aware, though, that there are some state laws that allow leave to care for other family members. There are requirements that you have to meet to be eligible to use the FMLA's benefits. So first, under the FMLA, an employee has to work for a private employer with at least 50 employees or for a government employer. And in terms of getting to the 50 or more number for a private employer, you can look at the number of employees within a 75-mile driving radius of your work site. So if you're working for an employer with multiple offices within 75 miles, you can add up the number of people working at each of the offices to hit that 50 mark. That can be really helpful for someone who's in a small office. So don't assume just because you are, that means you're definitely not protected. Additionally, employees have to have worked for their employer long enough to be eligible for leave. The FMLA requires that employees work for at least 12 months. There is some flexibility in that you can go back 7 years to find that total of 12 months. That could be particularly helpful if you work in a seasonal business where workers come and go. In addition, employees must have worked at least 1,250 hours during the last 12 months they worked for the employer. And that comes out to be around at least 24 hours a week if you're working all 52 weeks per year. What protections does the FMLA actually offer? It entitles eligible employees with up to 12 weeks of unpaid leave per year. Leave's unpaid. Obviously, a lot of people can't afford to lose income during this time, but keep in mind it might be possible to access some of your paid leave or even disability insurance benefits at the same time. The real benefit of the FMLA is that it allows what we think of as a bubble of protection. When you're using it, both your job and your health insurance are protected. An employee can't be let go for taking FMLA leave, and they also have return to work rights. meaning that when they come back from this kind of leave, generally they have to be reinstated into the same or an equivalent position to what they had when they went out on the leave. And an equivalent position means one with equivalent pay, benefits, responsibilities, and other conditions of employment. Job protection under the FMLA is important because generally when you take time off using regular sick time or vacation time, or even when you're using disability benefits, your job is not protected. Absent a state law that says otherwise, or a contractual protection, or a company policy that says otherwise, an employer can let you go during those leave times, so long as it's for a non-discriminatory reason. FMLA leave also protects your health insurance. So if your employer is paying for some or all of your health insurance coverage, they have to continue to do that when you're out on FMLA leave. They can't force you to take COBRA. This is solely protection for health insurance, not for other types of employee benefits. A lot of employers won't suspend those benefits while you're out on FMLA leave, but know that if they do have to reinstate them when you return. FMLA leave is flexible. You can use it in small segments of time or as a single 12-week block of time. So maybe you're going to use a couple of weeks off for surgery and recovery, and then when you start chemo, you're going to take 1 day off a week. Or maybe you're going to start radiation and you just need a few hours off one morning per week for those appointments. You can also use the leave time intermittently, meaning that you might not know you're going to need it, but on a day that you're not feeling well and you call in sick to work, you can access FMLA protection. In terms of the 1 year period you have for the 12 weeks, there are a few different ways of calculating that. It's up to the employer to decide how they calculate, but they have to make that decision apply evenly to all their employees. I often talk to people who have no idea how their employer calculates their employment year period for FMLA purposes, so I always suggest going to HR to find out. There is a notice requirement for leave that is foreseeable, meaning if you know ahead of time that you're going to need time off under the FMLA, let's say you know you're going to have surgery next month, you are supposed to give your employer 30 days notice. Of course, a lot of the time when we talk about cancer care, the need for leave is not foreseeable, and in those instances, you are supposed to let your employer know as soon as possible. An employer cannot make you exhaust other paid time off before it allows you to use FMLA leave. However, what an employer can do is require you to use that paid time off concurrently with your FMLA leave time. And even if your employer doesn't require that, if you want to access that paid time off, you can choose to use that time concurrently. Finally, the ADA can be a supplement to the FMLA, but it also could be something that you use instead of the FMLA. So if you recall, when we talked about reasonable accommodations, I mentioned that taking an extended leave of absence could be a possible reasonable accommodation. Why might you use the ADA if we have the FMLA? Well, one, you might need time off as a reasonable accommodation if you're not eligible to access the FMLA. Maybe you work for a small employer that's big enough to be covered under the ADA, but not under the FMLA. Or maybe you've only been at your current job for a couple of months and you haven't met the 12-month requirement that the FMLA has. It's also possible that you can access the FMLA, but you've used up your 12 weeks of time and need more. So it's important to understand your rights under both laws and how they can work together. We have a lot of other resources available regarding employment. This was obviously, today is just my attempt to give you an overview. I do want to talk quickly about situations where someone can't work, and that's where disability insurance comes in. Disability insurance refers to getting some sort of income during a period of time when you're not able to work due to your illness. The idea is to replace the wages you'd otherwise be earning, whether in whole or in part. And there are several different types. First, there's disability insurance through a private policy. These can be purchased directly from an insurance company. What we find to be more common is getting access to a policy through your employer as an employee benefit. Your employer may pay all or part of the monthly premium. actually speak to a fair number of people who aren't even sure if they have access to disability insurance at work, which is understandable. Sometimes it's something you sign up for when you are being onboarded, and then you don't think about it again unless and until you need it. Details of private policies are going to differ from plan to plan and from state to state. One thing that is common among them is there are two types. There are short-term and long-term policies. A short-term policy is typically going to be one that covers a disability that is expected to last for up to a year. A long-term policy is typically going to be for a medical condition expected to last for at least a year. In addition to private policies, there are a handful of states, they are listed on this slide, that have state disability insurance programs. Details vary by state. However, all the programs are short-term. You can check your pay stubs to see whether you've been contributing to your state's program. You can also find details on our website. We have a quick guide to state disability insurance and information on our state resources pages for those states with programs. Finally, there are two federal disability insurance programs. Both are administered by Social Security. They are Social Security Disability Insurance, or SSDI, and Supplemental Security Income, or SSI. The two programs have certain things in common and certain things that are very different. For starters, what they have in common is they are both long-term programs, and they both have the very same high standard of disability. To meet Social Security's definition of disability, someone has to be unable to engage in what Social Security calls substantial gainful activity, meaning you have to be unable to work, and not just unable to do the job you most recently had, but unable to adjust to any other kind of work. And you have to be unable to work because of a physical or mental impairment that's expected to last for at least a year or result in death. Social Security is a federal agency. However, the disability program is run through state disability determination service agencies. So sometimes things can be a little different depending upon where you're located. One of the most common questions about disability insurance that we get is, can I apply for Social Security disability benefits while I'm still working? And the answer to that is, it depends. The reason it depends is this step-by-step sequential process that Social Security goes through to decide whether or not someone qualifies for benefits. The very first question asked is whether you're working and earning more than this year's substantial gainful activity amount. This year, that amount is $1,470 per month. If you're working and earning more than that amount, Social Security is going to kick you out of the process and say you're not disabled. If you aren't working and making more than that, then there's additional evaluation about the severity of your medical condition and your ability to do work. It's a practical analysis. If you're still working, it could be tough to argue that you can't work. You're going to have to be able to explain why it is that you're working now, but unable to work in the near future. But there are examples of that in the cancer community. So for example, maybe you're working now, but in 3 weeks, you're going to be having a bone marrow transplant. So that's a little bit about what's the same about the two programs. There are differences, big differences between the two. SSI is based on, or eligibility for SSI is based on having low income and low resources or assets. You have to be at least 65 years old or blind or disabled, according to the definition we just talked about. The maximum amount you can get each month from an SSI benefit is $914. Most states add a supplemental payment to that, but those are modest. Another thing to know is that in most states, once you are found eligible for SSI, you are also eligible for Medicaid. In most states, that will be automatic. In some states, you'll still need to fill out an application. Because applying for SSI can take a while, Social Security will provide back pay to the date of your application if they decide you had a disability at the time you apply. So if it takes Social Security 6 months to approve your application, they'll pay you the 6 months of benefits back to the date you applied. And in your first check, you get those back payments. SSDI is not based on income. It is based on work history, whether you have a history of paying into Social Security and the recency of that history. Generally speaking, you have to have worked 5 of the last 10 years, and you need to have paid into Social Security during that time. Keep in mind, even if you don't qualify for SSDI, you might still qualify for retirement. The amount of your monthly SSDI benefit is going to depend on what you've paid into Social Security over your work history. However, it is capped, so no matter how much money you've made, the most you can get monthly this year is $3,627. There is a 5-month waiting period before you can get cash benefits from Social Security disability. However, as with SSI, there's back pay that's available. And in addition, there is also the ability to get retroactive benefits. Those go back from the date of your application for up to 1 year if Social Security decides your disability began before you apply. While SSI is tied to Medicaid, SSDI is tied to Medicare. However, there is a waiting period for that. You have to be receiving SSDI for a full 2 years before you get access to Medicare. If you want to see whether you may be eligible for SSDI or even what amount your benefit would be if you're approved, the easiest way to start is signing up for a My Social Security account online. That account allows you to view your entire work history, see what your full retirement age is, and see what benefit amounts you may be entitled to receive. Be aware that unfortunately, Social Security denies the majority of the applications it gets, but know that you have the right to appeal a denial. There is a specific process you have to go through. The first step is called a request for reconsideration, and you have to make that request in writing within 60 days of getting your denial. As with employment, we have a lot of resources related to disability insurance that you can access for more information on this topic. I do want to close by saying, I know that sometimes you can sit through a lot of webinars like this and come out of them feeling, hopefully, that you've learned something, but still being unsure about questions or having questions of a personal nature that you would like to talk to someone about. Triage Cancer offers a free one-on-one legal and financial navigation program. We speak with people who've been diagnosed, we speak with caregivers and with healthcare professionals. We get a lot of questions regarding health insurance, employment, and disability insurance, as well as on other matters. The easiest way to get started is to go to our website. You can fill out our online intake form. After doing that, you'll be prompted to schedule a phone call at a time that's convenient for you. A staff member will call you, we'll ask questions, we'll have some conversation, and try our best to provide you with accurate information with the goal of empowering you to take next steps. Sometimes that all happens in one conversation, sometimes we have several conversations, and the program is available and the intake form is available in both English and Spanish. I hope that you have found today's presentation to be useful and that you'll continue to stay connected with us. I invite you to attend more webinars and other educational events. You can sign up to receive our blog using the QR code on the screen. You can connect with us on social media. And also, if there are any healthcare professionals on today, you can order bulk copies of our hard copy materials and we will ship them to you free of charge. And with that, I will turn things back over to Carla to see if people have questions or for any wrap up.
Amanda, thank you so much for that very thorough, and I always stress this, easy to understand explanation about what Triage Cancer is, the resources they offer, and really importantly, ways to minimize the financial impact of cancer. As evidenced by the wonderful attendance today and the amount of questions I'm getting submitted and feedback, clearly this presentation was super important and well received, and I'm not surprised about that at all. So thank you so much for that. And thank you to our audience for taking time out of their day to be here and learn a little bit about Triage Cancer and this really important topic. As Amanda said, we are absolutely going to get to questions. I see a bunch of them coming in, and reminder, you can submit them by typing them into the questions or chat section of your GoToWebinar control panel. As we get to those questions, I do want to remind everybody that Needy Meds is also here as a source of support for healthcare savings and education. Again, you can find healthcare savings under the aptly named Healthcare Savings tab on needymeds.org. What you're looking at on the screen is simply a list of all of those different categories and ways to save on your healthcare expenses, which again includes but is not limited to medications. To learn more about these healthcare savings options, as I said, check out needymeds.org. Reach out to one of our call center counselors. That phone number is 1-800-503-6897, which you can find at the top right of our homepage. And I'll also have that contact information up at the end of the presentation. And you can also check out upcoming webinars, which is, in addition to being peppered with special topic webinars to learn about our partners and other important resources on your healthcare journey, we do pepper our calendar events with informational overview webinars about Needy Meds and the resources we have to offer. We do some deep dives, 15, 20 minutes on some of those healthcare savings resources you're looking at on your screen. And as Amanda had an opportunity to say, check out the Needy Meds calendar. Again, the calendar of events is on the bottom right-hand side of our homepage, and under that education tab, those are the places where you can find upcoming webinars. We have a ton of Triage Cancer webinars on that calendar of events. You can also find them obviously on the Triage Cancer website, but check those out. Amanda and I had an opportunity to chat yesterday. Well, actually, it was me doing all the chatting about how fantastic Triage Cancer is. I'm a huge Triage Cancer cheerleader. And the reason is because not only is the information crucial for those living with or caring with someone facing a cancer diagnosis, but a lot of the information is useful to anybody that is participating in their own healthcare. You can turn to Triage Cancer for reliable, accurate, up-to-date information so that you can understand your healthcare options, learn healthcare insurance lingo, and all of those things that I consider scary topics. Triage Cancer makes it really easy to understand. So again, there's a reminder how to go ahead and submit questions for Amanda, or certainly if you have any for Needy Meds. And I don't want to take up too much of your time with how fantastic I think Triage Cancer is, because you've all seen that for yourself. So I just encourage you to stay in touch with them by visiting their website, signing up for future webinars, visiting, following, tagging like them on social media, signing up for their newsletters, all of that fun stuff. So without further ado, Amanda, let's go ahead and get to some of these questions that came in. One of them that came in relatively early on as you started the presentation, and I think this is super important. This participant wants to know, can I apply for SSDI, which is Social Security Disability Insurance, and for unemployment at the same time? Great question.
So that's actually a question I get pretty frequently. So generally speaking, you can't be eligible for both SSDI and unemployment at the same time. Every state's unemployment program is a little bit different, but something that states have in common, or unemployment compensation programs have in common, is they require people to certify that they're able to work, they're ready to work, and they're actively looking for work. Social Security, as I had just talked about, requires that people are unable to work due to their medical condition. So those two positions, being ready, able, and willing to work, and being unable to work, are typically inconsistent with each other. Having said that, there are some limited exceptions. So for example, if you're someone who's collecting unemployment and then you become disabled, you might be able to continue collecting unemployment while you apply for SSDI. But in general, you're you can't really swear to one agency that you're able to work and ready to take a new job at the same time as you're swearing to a second government agency that you're completely unable to work.
Thank you so much for making that super clear. And Amanda, I will tell you one of some of the feedback that we're getting is all not only how the audience is appreciative of the breadth and scope of resources that Triage Cancer offers, but saying the same thing that you and the Triage Cancer team have heard from me many times over the years, that you take these really big, complicated, and to me, scary topics and break them down into a very clear and easy way to understand it, which is, which oftentimes is everything. Thank you for that. And thanks to our audience for asking questions, because I always say this in every webinar. If there's somebody in the audience that is thinking of something they want to ask, we encourage them to ask it, because chances are somebody else is thinking about it, or it's something somebody else will clearly benefit from. So another question that came in, Amanda, I bet you guys get this all the time. Here's what this audience member shares. I work part-time. Can I ask for reasonable accommodation?
So that is a short answer, and that's yes. So the ADA, as long as you are otherwise eligible for the ADA's protections, in other words, you're working for the correct size employer and you are a qualified individual with a disability as it's defined by that law, yes, the ADA applies to full-time employees as well as to part-time employees.
So important. Another question, Amanda, that came in is, and again, an audience member shared that they were recently diagnosed with cancer. This individual is asking, do they have to tell their boss that they have cancer when they ask for time off? Or can they just say, I need time off to take care for a medical issue?
Okay, that's a great question. I'm going to assume, sort of from these facts, that they're looking to take time off either under the FMLA, or maybe they're looking to take time off under the ADA. So if you're trying to access the protections of the laws that I talked about, your employer is entitled, when you make those requests, to ask for medical certification from your healthcare provider to show either that you're eligible for FMLA leave or that you have a need for the reasonable accommodation that you're requesting. But that medical certification doesn't have to include your diagnosis. So I don't know, for example, let's say you're in a lot of pain from treatments and you need time off to get those treatments and to recuperate. Your medical certification doesn't have to explain the reason for your pain or the reason for the treatments. It can just indicate that you are experiencing pain and require, certain treatments on whatever basis, and leave it at that without going the extra step to say, well, here's why. The one thing I want to just point out, though, if you do have a concern about your employer knowing the diagnosis, think about who's going to sign your certification forms. So you may not want to have an oncologist do that if you're that concerned about the employer knowing that you have cancer. You might consider whether your internist can sign the certification form, to sort of leave that a little more vague.
Once again, I am absolutely blown away, because that's actually a question that I have had for myself. Well, that might be a little bit of bending the truth. I've had other people inquire about such things and refer them to Triage Cancer, but I don't think I really quite understood it until it was explained that way. That is endlessly helpful. Thank you for that. We do, yeah, so important, so important. And I really, as I said, I do try and keep the question segment relatively brief. I think I'd like to wrap up with one final question. I think it's a great one, which is, we have more than one person attending today. It looks like they're representing various organizations, and they want to know how they go about having their organization added to Triage Cancer resource list. Is that something we should just have them reach out to Triage Cancer for at that info email? What do you recommend, Amanda?
I would say definitely send an email to the info address that's up on the screen, with information about who you are and what your interest is, and we will connect you with the right staff member who can help you with that.
That's what I was thinking as well. It's always good to collect as much information as possible so you can be forwarded to the appropriate contact at Triage Cancer. So, of course, I want to thank again Amanda for taking time out of her day to share her expertise with the Needy Meds audience. And I apologize, right on time as though he was planning it. The train conductor is passing by my house right at this moment. So I apologize if you can hear that in the background. Hopefully you can't. But thank you again, Amanda, and thank you to our audience for taking time out of your day to join us for a Needy Meds special topic webinar presented by our partner Triage Cancer about ways to minimize the financial impact of a cancer diagnosis. As I said, I can't stress enough what a fantastic and unparalleled resource Triage Cancer is. So please stay in touch with them. Visit their website, follow them on social media, and don't hesitate to reach out to them and the expert team that works there if you do have any questions. As you can see, they really go above and beyond to make sure that they have resources that are current, accurate, and up to date that users can rely on, but they also go out of their way to make things as simple as possible. And that absolutely includes understanding your options. Thanks, everybody, and please check out and sign up for upcoming Needy Meds webinars. There's a lot of upcoming ones from Triage Cancer on there as well, so we hope to see your name pop up on those. Thanks so much, everyone, and have a wonderful, happy rest of the day. Take good care. Thank you.